Today we're talking about a serious neurological condition known as ALS, or amyotrophic lateral sclerosis. This disease progressively affects nerve cells in the brain and spinal cord, leading to muscle weakness and loss of voluntary movement. ALS is often called Lou Gehrig's disease, named after the famous baseball player who was diagnosed with it in the 1930s. While ALS is a challenging condition with no known cure, understanding its symptoms, diagnosis, and management options can help patients and their families navigate this journey. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. ALS affects the motor neurons, which are responsible for controlling muscle movement. When these neurons degenerate, they lose their ability to send signals to the muscles, causing them to weaken and eventually waste away. As the disease progresses, it impacts daily activities such as walking, speaking, eating, and even breathing. The exact cause of ALS is unknown in most cases, but researchers believe that a combination of genetic and environmental factors play a role. The early symptoms of ALS can be subtle and easily mistaken for other conditions. One of the first signs is muscle weakness, which may appear in the hands, legs, or speech muscles. Some people notice difficulty gripping objects, stumbling while walking, or slurred speech. Muscle twitching, known as fasciculations, is also common and may occur in the arms, legs, or tongue. As the disease progresses, weakness spreads to other parts of the body, leading to more noticeable difficulties with movement and coordination. People with ALS often experience muscle cramps and stiffness, which can make movement painful and uncomfortable. The condition does not affect sensory functions, meaning that touch, vision, and hearing remain intact. However, as muscle weakness worsens, simple activities such as buttoning a shirt, writing, or holding a cup become increasingly difficult. As the disease advances, symptoms progress to more severe stages. Speaking and swallowing become more challenging, leading to slurred speech and difficulty eating. Some people require a feeding tube to maintain proper nutrition. Breathing also becomes affected, as the muscles that control respiration weaken over time. This can lead to shortness of breath, especially when lying down, and eventually the need for ventilatory support. Despite these physical changes, ALS does not typically affect cognitive abilities, although a small percentage of patients may develop frontotemporal dementia, which can cause changes in thinking and behavior. Emotional changes, such as uncontrollable laughing or crying, known as pseudobulbar affect, can also occur in some individuals. Diagnosing ALS can be difficult because its early symptoms resemble those of other neurological disorders. There is no single test to confirm ALS, so doctors rely on a combination of clinical evaluations and diagnostic procedures to rule out other conditions. A detailed medical history and neurological examination are essential in identifying signs of motor neuron dysfunction. Electromyography, or EMG, is a key test used to assess muscle and nerve function. It measures electrical activity in the muscles and can detect abnormalities consistent with ALS. Nerve conduction studies may also be performed to evaluate how well the nerves transmit signals to the muscles. MRI scans of the brain and spinal cord can help rule out other conditions, such as multiple sclerosis or tumors, that could be causing similar symptoms. In some cases, blood tests and lumbar punctures may be ordered to check for infections or autoimmune disorders that affect the nervous system. Genetic testing is sometimes recommended for patients with a family history of ALS, as certain genetic mutations are linked to the disease. Because ALS is a progressive disorder, a diagnosis is often made only after symptoms worsen over time and other conditions have been excluded. Seeking an evaluation from a neurologist who specializes in neuromuscular diseases is crucial for obtaining an accurate diagnosis and starting appropriate care. While there currently is no cure for ALS, various treatments can help manage symptoms and improve quality of life. The primary goals of treatment are to slow disease progression, relieve symptoms, and maintain function for as long as possible. Medications play an important role in ALS management. Riluzole is one of the first drugs approved for ALS and works by reducing damage to motor neurons. It may help slow disease progression and extend survival by several months. Another medication, edaravone, is given intravenously and acts as an antioxidant to protect nerve cells from damage. Although its benefits are modest, it may help slow decline in some patients. Managing symptoms is also a critical aspect of ALS care. Muscle cramps and spasticity can be treated with medications such as baclofen or tizanidine, which help relax muscles and reduce stiffness. Pain management is important, and some patients benefit from physical therapy, massage, or medications like gabapentin or amitriptyline for nerve-related discomfort. I just wanted to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, speech and swallowing difficulties are common as ALS progresses. Speech therapy can help patients maintain communication skills for as long as possible. Some people use speech-generating devices or text-to-speech applications when verbal communication becomes too difficult. A dietitian can provide guidance on nutrition and swallowing strategies to prevent weight loss and aspiration. Breathing support becomes necessary as respiratory muscles weaken. Non-invasive ventilation, such as bilevel positive airway pressure or BiPAP, can assist with breathing, especially at night. In later stages, some patients may choose a tracheostomy and mechanical ventilation for more advanced respiratory support. Decisions regarding breathing assistance are deeply personal and should be discussed with the healthcare team and family members. Physical and occupational therapy can help maintain mobility and independence. Exercises that focus on range of motion and stretching can prevent stiffness and joint contractures. Assistive devices such as braces, walkers, and wheelchairs can provide support as movement becomes more challenging. Occupational therapy can help patients adapt to their environment and use adaptive tools to perform daily activities. Emotional and psychological support is essential for both patients and caregivers. Coping with a progressive illness like ALS can be overwhelming, and mental health support is a crucial part of care. Counseling, support groups, and involvement in ALS organizations can provide emotional relief and practical resources. Because ALS is a complex disease, a multidisciplinary approach is often the best way to manage it. ALS clinics bring together specialists, including neurologists, physical therapists, speech therapists, nutritionists, and respiratory therapists to provide comprehensive care. These clinics help coordinate treatment plans, monitor disease progression, and adjust care as needed. Since ALS is progressive and significant symptoms impact quality of life, palliative care is an important option for those suffering from this disease. Palliative care works to optimize comfort and quality of life while you undergo treatment. As the disease progresses further, important conversations regarding the extent of life-preserving therapies such as invasive ventilation should be held. Conversations about preferences for end-of-life care are vital, and consultation with hospice when appropriate will optimize quality of life during the final months. Clinical trials are an important avenue for advancing ALS treatment. Researchers are actively exploring new therapies, including gene therapy, stem cell treatments, and immune-modulating drugs. Participation in clinical trials may provide access to experimental treatments that could slow disease progression. Patients interested in clinical trials should discuss their options with their healthcare provider. ALS is a devastating disease that affects motor function, but with early diagnosis and a comprehensive care plan, patients can manage symptoms and maintain quality of life for as long as possible. While there is no cure, medications, supportive therapies, and assistive devices can make a significant difference in daily functioning. A multidisciplinary approach that includes specialists in neurology, rehabilitation, and respiratory care can provide the best possible outcomes for patients and their families. Staying informed, seeking support, and exploring treatment options are key to navigating ALS. If you or a loved one has been diagnosed with ALS, consider connecting with ALS organizations for guidance and resources. Every patient's journey is different, and having a strong support system can make all the difference. Thank you for watching. As always, take care of yourself and make the most of your day.